Hello and welcome to Askimo TV. I'm talking today to Dr. Petros Vlastarakos. Dr. Vlastarakos is a specialist ENT surgeon. Hi, Dr. Vlastarakos. How are you?
Thank you very much. Fine, Joanne. Thank you for asking me for inviting me to this interview, and I hope something nice will come out for your viewers.
Dr. Vlastarakos, today we're going to talk about the indications for Aden tonsillectomy in children. So let's start off with, what is an Aden tonsillectomy?
Well, can you repeat the question?
What is an Aden tonsillectomy?
Okay. Now, the Aden Tonsillectomy is the removal, surgical removal of the tonsils and the adenoids. The tonsils and adenoids are lymphoid structures based, I would say, at the upper respiratory tract. So, in effect, they comprise the first line of our defense. And we have, I would say, an imaginary circle, an imaginary ring at the back of our throat, which comprises the palatine tonsils, what we call the tonsils, laterally, the adenoids superiorly, and the lingual tonsil inferiorly. So what this system does, and in effect, is sample the antigens from the environment, and then the body can make antibodies, and that helps our defense. And they play a rather important role, I would say, up to the age of 3.5. Then their role is rather less significant.
What childhood conditions would indicate that an Aden tonsillectomy would be required?
Okay. Now, an Aden tonsillectomy is actually two procedures: removal of the tonsils and removal of the adenoids. So there are common indications for the two, but obviously they are separate as well. The most, I would say, frequent common indication in children is obstructive sleep apnea. So the child is snoring in the night, but not only is the child snoring, but also stops breathing. So it does like a compression, snoring, and then the parents can stop can hear the compressor stopping and then starting again and stopping, etc. Now, in the mid and long term, that causes problems. Well, short term, in the short term, the parents can notice that the child is a bit more irritable. The child may be tired in the morning, with not a lot of, not very in the mood of going to school, etc. But also in the mid and long term, there can be complications like elevated blood pressure. So hypertension can be a result of obstructive sleep apnea, and in very serious conditions, you can get also heart failure at the right cavities of the heart. Now, so an obstructive sleep apnea is one indication, one common indication. As far as the tonsils are concerned, there are other indications like recurrent tonsillitis. And when we say recurrent tonsillitis, we mean either 3 episodes of tonsillitis for 3 consecutive years, or 4 or more episodes per year, or even 6 in a year, but after the first 6 months of observation. So that can be an indication as well. There are other indications, but I don't want to tire you with all the indications for taking the tonsils out. As far as the adenoids are concerned, I would say that gluey otitis media with effusion is also an indication for the adenoids to be removed when they are obstructing the area of the eustachian tube. So they need to be removed, really. And obviously difficulty in breathing, in nasal breathing, from the child's point of view, is also an indication.
Talk me through the operation and what happens in the operation.
Okay, so obviously the child is being put to sleep, and then we keep the mouth open with a mouth guard. We can take the tonsils out with a variety of methods. I would say that the most popular nowadays is using a bipolar diathermy to dissect the tonsil. So in effect, what we do, the tonsil lies in a triangular space at the lateral borders of the mouth, of the oropharynx. So what we really need to do is dissect the tonsil out of the bed, and obviously also perform meticulous hemostasis, because the tonsil has blood supply as well. So we start from superiorly and work our way down to inferiorly. Then we deliver the tonsil. We make certain that we take the other one as well. And we carry on with the hemostasis. Some people are using ties. Others are only using bipolar diathermy. There are various instruments, cold, steel, and hot instruments that can be can be used for a tonsillectomy. As far as the adenoids are concerned, again, there is a wide variety of methods and instruments that can be used to remove the adenoids. I would say that mostly, and especially in the UK, we palpate the tonsils, the adenoids digitally through the mouth when the mouth is kept open with the mouth guard, or indirectly we see with a mirror and see how big they are. And there are also optic fibers angled that can be used through the mouth, or optic fibers through the nose to visualize the adenoids. But in most occasions they are visualized through the mouth. And then we take them out, either with a curette, that is like it's a cold instrument, it's like a blade, or we can use what we call in the UK suction diathermy, which in effect is cauterizing and vaporizing the adenoidal tissue, and at the same time it's sucking the smoke, so we can see with a mirror what we're doing. And the disadvantage is that it's, I would say, it has a rather unpleasant odor postoperatively, and the parents are a bit concerned, but it's quite effective. Other methods apply, like a microdebrider. That's a new instrument, a relatively new instrument for adenoids, which can remove the adenoidal tissue precisely. And obviously we make certain that we have achieved meticulous hemostasis, and that's it.
Dr. Vlastarakos, just to end off, why are ENTs generally very reluctant to remove tonsils in children? What is the value of the tonsils in the body?
I would say that ENT surgeons are not really reluctant in taking tonsils out. I think that the NHS is a bit reluctant to fund these operations because obviously our resources are finite, whereas our demands for health services are perhaps infinite. But there are indications. When you've got indications, then you can advise the parents or the patient, if it's an adult, that the tonsils need to be removed. Now, what we really need to say to the parents or the patient, but especially to the parents when children are involved preoperatively, is that there is a 2 to 4% risk of a post-tonsillectomy bleed. So within the first 2 weeks after the operation. So that is an acceptable risk. Unfortunately, it's a risk of the operation. It's not a risk of the surgeon. So no matter how good you are, you'll get a bleed in your career, or more than one probably. I would say in about 0.5 to 1%, that means that the child will require emergency admission to the operating theater to stop the bleeding. In most occasions, it stops on its own. Obviously, the parents need to know. But as far as the value of the tonsils play a role up to the age of 3.5 years. After that, we have about 400 lymph nodes in the body that play a vital role to our defense. Imagine the tonsils like a very good German shepherd that you bought to guard your flock of sheep. Now, the shepherd was very good when you bought it to begin with, but at some point along the way, the shepherd, the dog, lost it. Now, the dog is not very good now, and you have one decision to make. Are you going to keep the German shepherd because when you bought it to do a specific work, or are you going to take care of the flock and remove the German shepherd from guarding the flock? Well, that's I would say is an interesting point of view for parents to understand why at some point we have to make a decision, keep the tonsils or take them out.
Thank you. Thank you so much for talking to me today.
You're most welcome. Thank you very much for inviting me.